So this morning, we're going to look at the role of the facilitator, challenges and opportunities, and we'll be covering these things specifically as we do that. So what's required to be a MAP making a plan facilitator? Currently, people must be doing peer support work, which you all are, and you're supported by the center to do this training. It's wonderful that West County Community Services and the peer centers are allowing paid staff time for you to do this. And then also that you're willing to serve as a making a plan facilitator for your center. And then at the end, you will get a certificate of completion to show that you have completed the training. So what's the role of the making a plan facilitator? This gives an overview of the role, and we'll be looking at this all more in detail as we go through the remainder of this class and on into next week too. So here's a checklist of sorts. So we're introducing advanced care planning with mental health in mind and the making a plan material to the peer member, encouraging the members to do making a plan, assisting members getting the making a plan toolkit, which are available in the centers, introducing the toolkit content so that the member will know what's in there and why it's important to do that, assisting them with completion of their documents, and then providing guidance for how to distribute those documents. And then also as a facilitator, being familiar with helpful resources, and then seeking assistance from your supervisor, who in turn would seek assistance from me if needed. But I think that you all, by the time you're done with the training, that you will be comfortable and skilled at doing this. And the managers have been working on this too, so, and Michael. So I think that you all should fare well with this. And then we're going to have a facilitator's log to track progress on time spent and outcomes achieved, to just give a sense of how that's going as you go along with that. And so for challenges, what are the challenges for doing this work? And there's probably more than this, but these are what came to mind for me. Number one, I think the predominant challenge is to hold the focus for ourselves, as well as the people, the members we're working with, that this is about living, not about dying. And over again, you'll hear me downplaying the focus on dying. It's just a little bit about what we're doing when we're doing this, making a plan, advanced care plan with mental health in mind. The wonderful thing about it is that as we do our advanced directive, it covers things for if we have an accident, seriously ill, we can't speak for ourselves. And it also is helpful if we are at the ending of life, living with a terminal illness. But that's not our focus. Dying is not our focus. So we want to always kind of remind ourselves to pull back from going down that path and stay more on the, I guess I say almost accentuating the positive, in that this is giving us a say if we're unable to speak for ourselves. If we, had those things that we talked about, an accident, mental health crisis, serious illness, and somebody needs to step in, that they know what our values and wishes are. Another challenge is overcoming people's reluctance to think about advanced care planning and the what ifs. because this calls up for us, like, you were pointing out, what if, and then I have to start thinking of all these different scenarios, and that can be difficult for people. But, again, like last week, we talked about words matter and how we frame this in terms of giving people voice and control and having their values and wishes known and honored, whether or not they're able to speak for themselves. All those kinds of things can help overcome people's reluctance to think about this and to do that. Another challenge will be drawing in the peers and stirring interest. And in our role plays today, we're going to role play some of that and how we do that. And, the things that you're learning in the class hopefully will help you as you get a comfort level with this and you find where that middle ground is, that is, having a sense of choice and control over what's going to happen if I do this. That's a powerful magnet, I think, to draw people in. Another challenge is that the peers must retain their own making a plan materials, so they cannot leave them at the center. We're going to, we have these Ziploc bags that are in each of the centers. Danette has some, and so does Sean, so that when people get their toolkit, we're going to encourage to give them a Ziploc bag that they have with it so that they can keep it weatherproof, waterproof, keep all their things related to this in one place so that it doesn't get lost. And then the challenge of this too is that they must bring their materials each time when they come to do a work session with you. So they're going to be working in their workbook and things away from the center, and when they come to meet with you, they need to bring this all again. So that's going to be, another challenge. And then overarching is, of course, how do we separate peer support work from making a plan facilitation? And how do we maintain the boundaries between those two? We're going to look at that much more in depth when we get to class 3. That we do that, we talk about that extensively in that class. And then as far as the opportunities, I think opportunities for doing this are that you all are routinely working with peers. They know you, they trust you. You're used to engaging with them, doing peer support on difficult issues and encouraging them, empowering them, and so on. And so that's a real opportunity. It's unique. It's something that others who would like to see this happen can't make happen because they don't have those relationships that you do. So you're in a unique position, and that's a great opportunity. So another opportunity is, to help the peers access the resources and to learn about, to know and realize their rights. So we talked last week about the fact that any of us over 18 have the right to give instruction and designate agents and have our wishes honored by law. And so, helping peers to realize that they have these rights and that they can be self-determining in terms of what will happen to them if something, what kind of care they will get if something happens to them is very powerful. And it definitely helps to improve the care for the peers that are served by doing the making a plan documents and completing that and having them understand what this is all about and thinking it through and getting it in order in a way that reflects who they are and what they want. It's very empowering, and it absolutely will improve care because as we said last week, healthcare professionals are obligated by law to honor a person's wishes when expressed in an advanced healthcare directive. And if they override those wishes and do things to somebody that was not wanted, they actually can be prosecuted for assault. The only exception is a 5150 hold, involuntary hold. Those laws would override the healthcare directive, but otherwise, it's powerful, to be sure that people get the care that they want. And so that's a great improvement, because too often without a directive, as we talked about last week too, health professionals are trained to do everything possible, and that's within their realm, and it's not what we necessarily want to have happen. And then another opportunity is that for peer support specialists and internship requirements or continuing education requirements, this is all recognized by peer centers and others as continuing education that really enriches the work that you're doing. And so with that, I'm going to pause and take questions. Let me just figure out the recording thing again. Why is this so difficult? So for this part of the training, Michael and I will do 3 different role plays. The role plays are about introducing the Making a Plan toolkit to members. And after each role play, we'll have class discussion, and about 10 minutes for each one of these, with including the discussion. And I'll facilitate class discussion, and we're going to have emphasis in our discussion will be about stimulating discussion about things helpful for you to know and understand when you're going to be doing this work. And so for the first role play will be drawing a person in, stirring interest, and emphasizing importance of self-advocacy. So here's the scenario. The peer was referred to you as the MAP facilitator in your center by staff to get help using the MAP toolkit. You want to learn what they know about advanced care planning and the Making a Plan program. And you let them know how you can assist, emphasizing the importance of self-advocacy when doing the Making a Plan work. Michael will be the member in the role play, and I will be the MAP facilitator in the role play. So we'll begin the first one with Michael as the member.
So in last week's peer member discussion group, there was talk about a new program that could help me to make my care wishes known ahead of a crisis. They said I could do that in a way that was legally binding on healthcare professionals and family members, helping when I can't guide my own care. I'd like to learn how to do that so I can do that for myself. I think doing this could really give me some peace of mind about things that bother me. Can you help me with this?
Yes, I'd be happy to help you. It's great that you are thinking about this now, when you are clear-headed and able to do this. I know from my own experience that I am not always able to think clearly during difficult times. You probably have thought some about what you would like to have happen. This will help you make your wishes known ahead of time while you are still well, while you are well. That is what the Making a Plan toolkit is all about. So let's get started. Do you know about advanced care planning, or have you ever done an advanced care plan of any kind?
I remember that my mom did something like that when she had a stroke a few years ago. She wanted my brother to know what kind of care she wants if her condition got bad, but I really don't know how that would work for me. Mom said that it helped her to relax about what would happen to her when the time came that she couldn't speak for herself. My brother was a lot less anxious knowing what mom's wishes are. I'm not sure how this is relevant to me since I'm not dying.
Well, advanced care planning is about living through serious illness and the ending of life. It's all about living. Any one of us can have an accident, serious illness, or something that makes it impossible for us to speak for ourselves. A mental health crisis is recognized as a serious illness under law. That's what's so great about the Making a Plan toolkit. We can state our mental health needs ahead of the crisis. Have you ever written a Wellness Recovery Action Plan or RAP plan? MAP is very similar, only it is more official. MAP is legally binding because we make it part of our Advanced Healthcare Directive.
That all sounds great, but complicated. Can you do that for me?
Well, this will be your plan expressing your wishes, so it needs to be thought through and written by you. I am here to be your guide and a sounding board to help you think through your choices. The MAP workbook is easy to use and was developed by people just like us, having lived experience with mental health challenges and other serious illness.
Okay, I'd like to learn more. Can you
Great,
tell me?
great. Let's take one step at a time. For today, we'll begin with what you already know. What your mom did is called advanced care planning. It sounds like she created an advanced healthcare directive, which allows her to name your brother to guide her care if she's not able to do so herself. The advanced directive would give your brother and her healthcare providers instruction about what to do if she couldn't speak for herself. In that case, your brother would make her decisions on her behalf about the care she should receive, honoring her wishes. It's common for people to do that concerning their physical care wishes. Does this sound familiar?
Yeah, now that you explain it that way, I do think that's what mom did. She told me that John would look after her when she can't speak for herself. She assured me that he knows what to do because she told him what she wants when the time comes and not to worry.
So what we are talking about with the Making a Plan toolkit, or a MAP as we call it, is basically the same thing. But MAP is doing advanced care planning with mental health in mind. The MAP materials are user-friendly with easy-to-read documents created by peers for peers with the help of behavioral health professionals. MAP was created especially for people living with mental health challenges to empower them to receive care they desired in times of crisis. Have you had a chance to look at the MAP toolkit?
No, I haven't. In class last week, they just talked a little about what it is, but didn't really show us anything. They said we could come see you if we're interested to learn more and get a copy.
Wonderful. Is this a good time to begin working on this?
Sure.
Good. To begin, I'll give you a copy of the Making a Plan toolkit, and I'm going to give you this Ziploc bag to keep it all together. And be sure that it's protected from the weather should we be fortunate enough to get some rain. For confidentiality reasons, we cannot keep your personal MAP materials here in the center. You must keep them with you and bring them with you each time you come to meet with me and do MAP work. Is this okay with you?
Yeah, I get that'll be fine. Thank you.
Sure. Now let me put us on pause here for the record. Okay, so our role play number 2 this morning is introducing the MAP toolkit and how it works. So here's the scenario. The peer member is beginning their first MAP work session with you using the MAP toolkit. To open the work session, you will give them a copy of the MAP toolkit, let them know how you can assist them using that, and determine if they would like to proceed working with you to do advanced care planning with mental health in mind using the toolkit. For class today, you can follow along with your toolkit if you want. So here we go. Hello, Michael. I'm so glad you decided to do advanced care planning using the MAP toolkit. Using the copy I gave you, let's review this together.
Yeah, that would help me get an idea of what's involved.
If you open your MAP toolkit, the first thing you will find is the cover sheet. Let's see what all the component parts are of the MAP toolkit by looking at the cover sheet. You'll see there it lists each item and a little bit about it.
Is this the form you're talking about?
Yes, that's it. That's the one. It's your guide to all parts of the toolkit. So let's review that briefly. Now, to get started, pull out the booklet that says Part 1 Workbook. Yeah, that's it. If you look on page 4 in the workbook, there's a table of contents outlining the steps in the workbook. Do you have any questions so far?
Yeah, see in the contents of Part 1 a reference to Part 2 forms. What's that?
Let's take a look in the toolkit package and see if we can find the section labeled Part 2 forms. There's actually a section in the toolkit that's forms.
Oh yeah, here it is.
Yeah, that's it. So let's look inside that. So Part 2 contains 2 forms you will need to fill in as part of your advanced care plan. One is the Advanced Healthcare Directive form, and the other is the Personal Request form.
And when are we going to fill these in?
Well, after our review today, you can take your toolkit with you and begin completing it yourself. You may want to work with a family member or a friend you think of as a trusted helper. The workbook gives you guidance about doing that. Fill out all that you can and then come back in to meet with me again, if you like, for help along the way. Here at the center, I can do 2 more work sessions helping you with MAP work if you like. You just need to let me know when you would like to schedule another work session and we'll find time that works. It's just like how we do peer counseling sessions here at the center. MAP sessions can be set up 30 minutes long if need be each time we meet, including today.
Okay, so if I start on my own and I have questions, who do I ask?
Well, if you're working with a trusted helper, see if they could help answer your questions. It's best to go through the entire toolkit, reading things very carefully and reflecting on issues before you actually begin completing the forms. I suggest you do that and make some notes along the way, then schedule another MAP work session to come in and meet with me to talk over your questions and work on completing your documents. It's important to read the cover sheet and workbook carefully, as that will answer many questions you have and provide you with good guidance.
Okay, that sounds good. I'll do that. But what I'm wondering is how will I know if I completed the documents correctly?
We can schedule a session to review those when the time comes.
Cool. And if I would like to do a map with your assistance, when can we start?
We can start today and then schedule 1 or 2 more sessions for me to help you complete your documents along the way when that's helpful.
Yes, that would be great. Let's get started.
Okay, well, we need to be aware that some of the topics in this workbook are very personal. So it would be better if we find a place that's quiet and private to maintain confidentiality. Is there some place here that you would feel more comfortable, or is it okay where we are?
We could use the small conference room here at the center. I'll check with the center manager if that would be okay.
Oh, there's one more thing that is important for you to think about before we start. Doing this work might bring up some topics that could cause an emotional response and may need a deeper discussion or peer support. This would be something not directly related to completing your advanced care plan, but nonetheless important to talk about. We need to be thinking about what we would do if that happens. You're in the driver's seat. You could make note of the issue and then schedule a time to meet for peer support later. Or if you prefer, we can stop work on MAP and switch to peer support right away if we have time needed. So I want you to be thinking about how you would handle that if something like that occurs. For now, I just want you to be aware that this could happen. If it does, we'll decide how to handle it in the moment if that works for you.
Yeah, I'm good with that. Thank you for letting me know. If something feels urgent to address, I'll let you know. I would like to get the MAP process done in a shorter time as possible, so I'll probably just postpone the additional peer support for later.
Great. So let's get started. Now, for the class, let me, oops. So for role play 3, this is beginning the advanced care planning with mental health in mind kind of conversation using the Making a Plan toolkit and also addressing trigger issues. So here's the scenario. This role play illustrates how we can orient the person in terms of things that MAP may trigger and how to handle if an issue arises that requires peer support. So here we go. As you know, the Making a Plan toolkit addresses what kind of care we want if we can't guide our own care. That could happen if we had an accident, had to have surgery, were seriously ill, or had a health or mental health crisis, making it impossible to direct our own care. Thinking about all of this may trigger things for you that would best be addressed in a peer support session. It's important that you always feel in control of this process. You are in the driver's seat, and I am here to be your navigator. This will be your plan, and you get to decide all the steps along the way. To begin now, what kind of support do you need to feel in control?
I would need to be in a quiet, private place.
Is there a place here that you would prefer for us to work?
We could use the bench outside the center. It's in the shade, has a bench and a table. It's away from the main entrance and parking lot, so it would be quiet and pretty private.
Sounds good. We can spend up to 3 sessions working together to complete the MAP workbook and forms. What day and time works best for you? Let me check my calendar and see when I'm available.
Mondays at 2 work best for me.
Good. Mondays at 2 will work for me too.
Cool. Looking forward to getting started.
Before we meet again, please read carefully through the workbook and think about how you want to answer questions that come up as you do that.
Okay, I will read through the workbook before I see you next time and start thinking about what I would like to include in my plan.
Now remember, as you go through the workbook, it just might raise topics that trigger emotional response. Be thinking about what kind of support you might need that could work best for you if that happens.
Usually if I have a few minutes, I'm usually able to calm myself. Grounding exercise sometimes help, like taking a moment to take a few deep breaths or look around at my surrounding areas to remind me that I'm in a safe place. I like to put my feet firmly on the ground, hold on to my seat, name some of the things I can see, hear, touch, or smell can also be helpful for me. If I can't calm myself in the moment, I would need to stop my MAP work session and schedule to continue later.
Thank you. It's very helpful to know what will work for you. This is a great example of advanced care planning in action. If doing that doesn't work for you, you will be welcome to take up whatever issue may arise in a peer support session. Depending on the urgency and how much time we have left in our MAP work session, we could do some peer support right then and there. We'll see how it goes, and you'll be in the driver's seat no matter what.